Our listeners that have been longtime listeners know that I am an absolute believer in a hygiene-driven practice. Hygiene-driven practice is a model for success in many ways. And maybe we start with, it's what's best for your patients. If we can see your patients on a regular basis, if we can get them committed to a regular schedule, regular scheduled appointments in your hygiene department, then we're going to keep them healthy. We actually accomplish two things with them. We keep them as healthy as possible, and we reduce their future dental expenses by finding issues at their earliest stages and then addressing those when we can treat things more conservatively. For example, when we find decay, we can treat that with fillings before it becomes something that is more comprehensive, like, say, a root canal and crown. So a hygiene-driven practice is in your patient's best interest. And maybe that's the best place to start with this. However, the particular inspiration for this podcast episode was a call I received recently from, at that time, a prospective client, now a client in my coaching practice. And he shared this with me. He said, Gary, I practice in Orange County, California. And he said, as you know, wages are going up in hygiene. And I recently decided to take a look at my numbers with the help of my accountant. And we have some plans, some PPO plans in our practice where we're being reimbursed less than $60 for an adult hygiene appointment. There are plans. Now, not all plans are that way. Plans can be written different ways with different reimbursement levels. But he said, we have some plans in our practice, some PPO plans, where I'm getting reimbursed $60 for a hygiene appointment. And that would include everything. That would include exam and x-rays as well. And he said, I am paying between $75 and $80 an hour for my hygienist, paying $75 to $80. And he said, this is really causing me to look at that, and it's just not viable for me to. I'm not even covering the hygiene wages with the reimbursement that I'm getting from the PPO plan, let alone the other expenses. We know there's other expenses. There's the room, there's the equipment, there's the treatment room, there's the equipment, there's the consumable supplies that your hygienist is using, and then there's the administration time that it takes to keep the hygiene schedule filled. And when you look at all of that, not only is he losing money, but he's literally bleeding out when you look at all of that. And that isn't a viable business position to be in. And he said, Gary, I cannot see, continuing as a PPO model, because hygiene wages are going to continue to increase. And then throw on top of that, with many PPO plans reducing their fees. So it's going to get worse as time goes on. It's not going to get better. So he became a client because he wants to learn how to successfully reduce insurance dependence in his practice.